Thanks for being here today, everybody. Premier Moe will have an opening statement, followed by Dr. Shahab. We'll then have time for questions, and like the previous sessions, we'll do one question, one follow-up. Premier Moe.
Well, great. Thank you again, everyone, for coming here today. Today, in consultation with the Chief Medical Health Officer, the Government of Saskatchewan has announced that all classes in Saskatchewan, pre-K to 12, will be suspended, and they'll be suspended indefinitely, effective March the 20th. Over the next couple of days, our classes in this province will wind down. This means that parents who are able to keep their children at home, they should do so immediately. Parents with limited childcare options have a window to plan for these class suspensions. Yesterday, the Chief Medical Health Officer indicated that school closures would be based on a number of factors. The first is evidence of sustained transmission within the community. Second was the rapid increase in local cases. And third was transmission without a known link to travel or confirmed cases. While none of these criteria have been met to date in Saskatchewan, we believe a preventative approach of proactive school closures beginning on March the 20th means that we will reduce the risk of COVID-19 transmission in our province. Every student will receive a final grade based on their current grade, and students will progress to their next grade level next year. Teachers and education staff can work from home or in the schools as scheduled during the class cancellations. The Ministry of Education will work with the school divisions and the teachers to implement a supplemental curriculum program using distance and alternative-based measures. These measures will also apply to daycares that are co-located within the schools, but they do not apply to licensed daycare facilities outside of the schools. Further measures regarding licensed daycare facilities are being considered, and it should be known that they may be implemented at a future date. Officials are currently examining options to provide childcare services for individuals that are providing essential services during our COVID-19 response. The Chief Medical Health Officer of Saskatchewan today has ordered some further restrictions. Visitors to long-term care homes, to hospitals, to personal care homes, and to group homes are restricted to essential visitors only. Essential visitors means immediate family members that are visiting for compassionate reasons. Faith-based organizations are no longer exempt from the public gathering restrictions. Sask Gaming will close casinos Regina and Moose Jaw until further notice, effective at the close of business this evening. And I would like to encourage everyone who is wondering if they should be tested to use the self-assessment tool that was launched over the weekend on the government website. And I understand that tens of thousands of people have used that tool already. And I would remind people to be reasonable when you're out doing your grocery shopping. Buy what you need. There is no need for us to hoard. At this point, we do not believe that coronavirus itself is going to cause shortages in our grocery stores. But hoarding most certainly will. So don't do it. And finally, if you are a Saskatchewan resident traveling abroad, it's time for you to come home now and then self-isolate for 2 weeks. I think the federal government has done the right thing today by barring virtually all foreign nationals from entering Canada. The vast majority of cases in Canada right now can still be traced back to foreign travel. So coming home now, it's the right thing to do. But Canadians abroad are also at a high risk of being exposed to COVID-19. So come home and come home immediately. And when you get home, self-isolate for 14 days. I think Dr. Shahab may have a few things to say, and then we'd be happy to take any questions that you may have.
Thank you, Premier. So I just want to say that, while we continue to have very few cases, and we have a 7th case now with, again, travel to the U.S., to Arizona, I think these are significant steps that we are taking ahead of any significant community transmission, which has happened now in several Canadian provinces. And I would like us to view this as a calming thing that we can do in terms of spending more time with family as kids are at home. we need to support really our friends and neighbors who work in essential services, who work in healthcare and have to go to work, who work in other essential services, trucking industry or bringing goods into Saskatchewan, utilities. They are our friends, our friends and family who have to go to work. They need our support as well at this time in terms of childcare and other needs. But otherwise, for the rest of us, obviously, the direction really is to stay home as much as possible. Self-isolate, obviously, if you've traveled. Self-isolate if you have any symptoms. Use healthcare services judiciously. Go to the website for information. Only call Healthline if you currently have traveled and have a fever and cough. Further advice will be provided if there's any reason to call Healthline without any travel. That would only happen if there's community transmission. And similarly, use your primary care, the time of your primary care physician judiciously so that they have time to look after, at this point, very few cases. But if we were to get more cases, they have the time and space to look after people who need care.
Well, questions now. I have Arthur, then Murray.
Who actually made this decision to suspend the schools and on what basis? Because, as you noted, as of just this week, and Dr. Shahab, you were not recommending that this is necessary. It does not seem as though anything has changed in terms of community transmission. Was this made because of your guidelines or despite your guidelines?
So 24 hours is a long period in this outbreak, and we looked very closely, together in health, education, government, and along with my colleagues in other provinces, we looked very closely at the epidemic curve in the U.S., in Canada, in Europe, in each of our provinces. So all of us in different provinces are at different states. We really are several weeks behind several other Canadian provinces. We just have 7 cases all linked to travel or the household contacts, but we don't want to be as much as we can in a place where some provinces are seeing a significant increase in cases. They're seeing cases due to group events. They're seeing cases due to local transmission. So we really thought it'll be, and there seems to be strong public support for going early with this. And so that's why, if there's strong public support, a good rationale to do so, it's really good to actually go early. And for most people, it should be a reassuring thing. For some, it will be a bit of hardship. But I think we all need to collectively support ourselves, our families, our neighbors, and our communities during this time.
The goal is to be as preventative and proactive as we possibly can, while balancing that with some of the normalcy of life, if you will. And we're trying to strike that balance. With respect to collaboration, there is collaboration going in every direction. I myself am talking to Dr. Shahab frequently, I would say daily, likely multiple times a day on many days. The Minister of Health would be much more than that, as well as Dr. Shahab is talking to his colleagues across Canada, also on a very, very regular basis. I was on the phone with a number of premiers over the course of the weekend, and we're trying to do what we can to ensure that we're sharing information interjurisdictionally, if you will, as to the measures that we are taking. And we are doing that. As Dr. Shahab has said, we are at different levels of this pandemic in different areas of Canada, and so we are working very closely with our colleagues, our respective colleagues, as well as one another, to make what are the very best decisions that we can to balance that normalcy of life with the most effective, proactive, and preventative measures, and really trying to make decisions for the betterment of families here in Saskatchewan, and we truly are trying to make every decision with that in mind.
Just wanted to ask Dr. Shahab if you have any updates on the 6 cases, whether they're still self-isolating at home or whether anyone in the province has been admitted to hospital with the COVID.
The information I have is that no one is in hospital. The cases are being self-isolating at home. All their contacts have been followed up. Contacts are also self-isolating at home for a 2-week period, and that remains very important both in terms of cases and contacts, and also will continue to be extremely important for anyone who's coming back from anywhere in the world. Self-isolation at home for 2 weeks is essential to try to keep this outbreak to as low level as possible for as long as possible. 7 now.
Just been too slow in your reaction. This is the last province today to close public gatherings. We're not closing schools until Friday. We're going to be the last again. Many people are saying that you're sending a disjointed message to the public because that's not what they're getting from other provinces. That's not even line of what they're getting from Dr. Shahab in terms of the immediacy of the problem and the need to avoid social contact and social distancing. Do you think you've been too slow and your government has been too slow in implementing some of these measures that you're now implementing?
No, most certainly not. I feel this is the appropriate time to be implementing the measures that we are. We've had 6, now 7 cases here in the province. That's a very different level of infection rate if you look at other provinces across Canada. And we have been able to rely on some of what they've done and implement that here much earlier, I would say, in the curve, if you will, than other provinces have. Case in point is the school closures today. I was on the phone with a number of premiers this weekend discussing just this and how, with respect to these school closures in this province, we wanted to provide an opportunity where if parents wanted their children to not be in school, they could pull them out immediately. But we also wanted to provide that support, understanding that Saskatchewan is still at a relatively low risk. Provide that support to other parents that may need a few days to organize how they are going to, provide their child care in the weeks ahead. And this may go on for some time, as classes are suspended indefinitely. They are, not suspended for a number of days.
How is this consistent with the message that if this is about stopping community transfer of COVID-19, we're already too late in doing so by moving now, that it had to be done earlier and quicker, as WHO is telling us, as other organizations are telling us around the world, as other provinces are doing. It would seem inconsistent with that messaging, sir.
Well, other provinces, in many cases, have a much larger people that have tested positive relative to Saskatchewan, where we are at 7, and all of our cases, as Dr. Shahab, and he may have a comment after myself, all of our cases can be related to someone that has traveled or traveled abroad. Listen, our approach to this is really boiling down to 3 areas. The first is restrictions. And you're seeing some of these further restrictions today. You may see some more tomorrow or the next day or the day after that, as this is an evolving situation. So we will continue to focus with the close consultation of Dr. Shahab and others on what those restrictions should be and when they should come into play. The second will be the resources. The resources, most certainly for our healthcare system, and I'm here to say that as those resources are required, they will be provided by this government. And the third will be the recovery. There is going to be an economic impact with what is occurring today and what is going to occur over the next number of weeks, and we are already having conversations with respect to how can this government ensure that the economy in this province and this nation has every opportunity to recover.
I've got Sarah.
Sorry. Can you speak to the overall reaction? Seems a little bit ad hoc. My 9-year-old can't be in school, but my 5-year-old can be in a licensed childcare centre, and other 5-year-olds and 3-year-olds that are in a joint use school cannot be. It seems a very ad hoc approach, 24 hours after the doctor who advises people to get immunisations and the province says, yes, Dr. Shahab, we should do that. The same doctor who encourages us to get flu shots and eats winter, and most people do, and the same doctor that presented evidence yesterday that says these measures aren't yet necessary. Are you doing all of this against his advice? And why the ad hoc approach?
I will let Dr. Shahab speak to how we are acting. I believe it is very collaboratively. With respect to the licensed childcare centres that we have, there may be more to come on that in the days ahead. With respect to the ad hoc approach to the decision-making, or the appearance of ad hoc approach to the decision-making that is occurring here, this is an evolving situation. It's evolving not just in Saskatchewan, but evolving across the nation. And to ask what has changed in the last 24 hours with respect to any communications coming from Dr. Shahab, or quite frankly other chief medical officers in other provinces, is our neighbouring province yesterday had, over a 24-hour period, had 17 cases of positive cases of COVID-19. Many of those were through community transmission. Alberta is not that far away. We most certainly, now that it is that close, had a number of discussions with respect to how can we ensure that we are being proactive and preventing, maybe not stopping, but preventing those types of occurrences here in Saskatchewan. If you want to speak a little bit to whether or not we're working collaboratively or not.
The other thing I would say is, we just listened to the federal government announcement. And so there's some significant things happening nationally. Many Canadians are coming home from Europe, from the U.S. All of them must self-isolate for 2 weeks. That is essential. While it's voluntary, it is essential that anyone returning to Canada self-isolate. We know that through that process, through many people coming back, we will see an increasing number of cases travel-related in Saskatchewan. We in public health must immediately follow up with cases and their contacts. And while we do all of this, we do know that it will be difficult to keep up with all the case contact investigations. We've seen that happening in other provinces. We've seen that happening in Europe. So as that happens, it is important that we further restrict large gatherings of individuals, those at high risk. So that could be the elderly, but also, although the risk is lower in school settings, we also, now start easing into those restrictions as well. And then, of course, we talk about the most vulnerable. It's really important that not only do we self-isolate after travel, but if we have any symptoms of fever or cough, we stay home. We don't visit people who are elderly or have symptoms in their homes. We don't visit them while we are sick in long-term care facilities, personal care homes, hospitals. And when we do visit someone in a personal care home, it should be our immediate family member, and especially limited if you've traveled from overseas. All these steps are really coordinated to really, since we expect to see more cases initially travel-related, and at some point we will see community transmission. So we're just leaning into it so that if and when that happens, we delay that as much as we can, and we minimize further transmission in various settings.
As a follow-up then, given what you've both just said, that likely community transmission will happen, we've seen it elsewhere, why not now start tests? Why restrict to the travel? Because you can't police 1 million point whatever people on whether they go out or see other people. You're urging them to, they may not listen, so why not just, if someone presents with flu-like symptoms, why not just test them?
So the advice will change that if you have flu-like symptoms, you stay home. If your symptoms are significant enough, this is for people who have not traveled, if your symptoms are significant enough to require care, then you are being offered a test if you need care within a hospital. All outbreaks in long-term care facilities will be investigated for other respiratory infections and COVID-19. But just like other respiratory viruses like influenza, there's no recommendation to test everyone, and that will be the recommendation in Saskatchewan even if we were to see wide community transmission. The way to control it is to stay home while you're sick. Once people recover, they are no longer infectious. The testing really right now is focused on people who have traveled, because that is where most of the importation is. But certainly if there was evidence of a cluster, people who have not traveled will be tested, and they are already being tested in the hospital setting and in long-term care facilities.
I've got Adam and Sam.
Tomorrow's St. Patrick's Day, and some restaurants have closed, but not a lot. The Prime Minister just said people should stay home. I know we're not closing restaurants and bars, but what do you say to people who are going to be gathering in these places? What's your advice to staying home versus not staying home, the Premier and the doctor?
Well, this again is speaks to the balance with respect to being safe, ensuring our families are safe, and attempting to carry on with some normal degree of life here in Saskatchewan. So my advice, I think, would mirror the Prime Minister's advice. This is a time for us to stay at home unless it is absolutely necessary that you go out. Stay at home, and to the doctor's point, enjoy your time there with your family. Call it a staycation, if you will. But if it's not necessary to be leaving your home, this is a fine time to be staying at home.
And a follow-up would be there's some groups that are calling on a financial assurances for people that now have to stay home, paid sick leave, different income procedures. What can you say to people about what the plans are for the government for people that are going to be affected by this, for their business closing down or having to self-isolate, stay home?
Right, and so right now what we are very much focused on in consultation with our Chief Medical Health Officer and our Saskatchewan Health Authority, as well as our colleagues across Canada, is on the restrictions, ensuring we have the appropriate restrictions in place to manage, if you will, this pandemic in Saskatchewan, and to do our part in helping manage it across Canada, to limit to whatever degree we can community transmission, to limit the amount of COVID-19 that we see coming in from other areas of the world. Next, and we are starting to have discussions around how we ensure we have the proper and appropriate resources in place as a province and as a nation. Those resources first are to ensure that we have the healthcare services where we need them, when we need them, and we are working on that with the Saskatchewan Health Authority. And then second is to ensure that if there are resources that are necessary for our small businesses, for our employees, for our employers across the province, we're reaching out to have those discussions now as well. But I would hope that all employers and employees are taking the advice of the Chief Medical Officer, Dr. Shahab, the Federal Chief Medical Officer, Dr. Tam, very, very seriously to stem or flatten the curve, if you will.
We got Steph and Josh.
I guess, what are you all waiting for when it comes to putting restrictions in place, when it comes to, closing non-essential businesses, maybe some other measures that restrictions other provinces have taken and other countries have taken, which seem pretty inevitable that we're going to head there. So I suppose, what are you waiting for, and why the strategy of easing into these and having press conferences maybe every single day announcing new measures instead of kind of putting these inevitable restrictions in place and leaving it at that? What's the strategy?
We will have press conferences virtually every single day, and I think you'll see updates from Dr. Shahab and others, if not every day, virtually every day in the days ahead as we enter into the start of the curve of COVID-19. And we will step up our restrictions as required on the advice of the medical community, on the advice of Dr. Shahab in particular, as we go through the next number of days. And we'll balance that with some degree of normalcy in our communities. Listen, we, as Dr. Shahab has said, we need to remain calm as a society, as we move through this, as individuals in the society, and we need to support one another as communities in Saskatchewan and as Canadian communities. There are essential services that we'll have to look at some point in time, potentially. I don't know that yet. We'll see what the curve looks like, and we'll know more once we go through this over the course of the next number of weeks or months or whatever that is. But there are changes to our life as we know it, and we are trying to take every opportunity to communicate those changes as they come forward to the people of the province, and that's what we're doing here today. I think a significant change in the way that we are changing how education is delivered here over the course of the next number of months and for the indefinite future. Anything else on that?
I guess my follow-up is, are you considering ordering some kind of restriction on travel to, say, Alberta, Manitoba, other provinces, or asking the Prime Minister to kind of restrict new provincial? I'm not sure how much power you have on that one, but are you considering that given the community transmission in Alberta?
So we began the restrictions with respect to government travel, is all approved by the Deputy Prime Minister to the Premier with respect to any government travel that goes on. With respect to other travel across the nation, we continue to discuss that, but we've been focused on some of these other areas to date.
What I would, and so, because our risk has been very low, that's why we have to lean into this in terms of, we learned how to do social distancing last couple of weeks. Many people are already limiting their own gatherings and events and behaving very differently, which was great. In terms of travel, last week we announced that if you have come from other provinces, don't visit long-term care facilities, and certainly don't go to big conferences and gatherings because that was a higher risk. And that already now we have had a case in Saskatchewan who did not travel internationally but went to a large conference in another province. So, even if you travel to other provinces, you have to be aware of where you're going, avoid large crowds. Large gatherings are themselves becoming less common all over Canada, so which is a good thing. So it's not just travel itself, it's how we interact with people anywhere in Saskatchewan and other provinces. So I think all those things are going to be important in the future. And also as we move in between towns and communities for work or to meet friends and relatives, how we interact as we move and visit is going to be important as well.
Got Josh from Jeff.
With the school closures, I have two questions. How much did public backlash play into the decision to close the schools today? Because I know 24 hours ago you announced that they were going to stay open for as long as we can, and then there was immediate public backlash. So how much did that play into the decision today?
Listen, the decisions that we make, and we make them in consultation with Dr. Shahab, and it's important that we do continue to make decisions based on the medical advice, the community health advice that Dr. Shahab provides so graciously to this province. They're not all going to be popular decisions, but we need to make what are the very best decisions on behalf of the families in this province, and we will continue to make those. We'll continue to work with our chief medical officer in making what are the best decisions. What changed in the last 24 hours is the community transmission that we had in Alberta and the fact that Alberta had taken some very quick action. We then had a discussion, is there an opportunity for us to limit our risk to that type of community transmission, if you will? And we had collaboratively talked about this decision that we came forward with here today. We understand that the public has been asking for this for a little more than a day now, and quite ambitiously and aggressively, and we hear that, but we need to make the decisions that are in the best interests of the safety and the public health of our communities and our families. And it's my true belief that's where we've landed today, and we've landed in a spot where people, families can keep their children at home immediately, or if they need a day or two to transition into this, understanding that we are still at a very low risk, in a low risk situation here in Saskatchewan, this is the time to make that transition, have a few days for families to make other arrangements for childcare, and have a few days for our school divisions and our teachers to transition to a distance-based learning opportunity for kids that want to continue to have access to their curriculum.
And then obviously a thing that's been happening over a period of time has been the teacher dispute. So how much does the school closure affect those negotiations, and how much of a role did the dispute play into either delaying school closures or anything like that?
Well, the ongoing issues with the STF played no role in the decision that was made, and I think the Premier and Dr. Shahab have made that pretty clear. We'll continue to have any conversations that the STF wants to have with respect to negotiating. I think the situation that we're in now is probably takes a little bit of precedence over that conversation. But having said that, I'm willing to continue the conversation with the STF if they're willing to return to the bargaining table.
We would view them as separate conversations, I think, in premise.
Can somebody explain the rationale of the Saskatchewan Health Authority direction to healthcare workers that if you've returned back home to Saskatchewan prior to March 16th and you don't have symptoms, then you don't have to self-isolate and you can go to work? I can't at the CBC. Yeah. And I'm trying to understand what the rationale is for doing that when we just heard the Prime Minister say everybody coming back to Canada has to self-isolate.
I think the Prime Minister also made exceptions in the case of healthcare workers as well as truckers that are essential service transporting goods across the border. So what we have done there is mirrored the federal policy, and I'll let Dr. Shahab or Minister Reiter speak to that.
No, go ahead. So that's an excellent point, and as you know, for the vast majority of travelers, the safest option for them, their families, and the community is to stay home for 2 weeks. There's no ambiguity and no risk. Healthcare workers actually have to self-monitor themselves now continuously. If you work in healthcare, you have to use appropriate precautions and monitor yourself not just for 14 days but ongoing. And if you get symptoms, you get tested. If you're positive, you stay home till you're clear. If you're negative, you continue to work as long as you don't have fever and anything that's infectious, if you just have a cough. And obviously, as healthcare workers are coming back or were coming back, and physicians from overseas trips or conferences, if you can, you should stay home. The mass majority should stay home. If you have to work because there's no one to cover you, then, so let me complete that. So then you don't just go to work as normal. You have to use some special precautions. You have to wear a mask. You have to closely monitor your symptoms and stay home, even if you're essential, if you have the first sign of symptoms, and get a test. So these precautions have been put in place to maintain the work for specific healthcare workers who are asymptomatic. Similar, actually, exemptions have been allowed in Saskatchewan, other provinces, and federally for airline crew, for example, who are traveling back and forth. They can't self-isolate every time they come back. They've been applied for the trucking industry, so it's essential that our grocery stores are stocked. But even in the trucking industry, for example, it's not. You still have to monitor your symptoms very closely. You have to isolate yourselves from others, and you can in that industry avoid large gatherings. So these exemptions are done with specific additional precautions and provisions.
That still doesn't make any sense to me because, you said they're supposed to be monitoring their conditions on an ongoing basis, and that's exactly what I would expect. So I would expect whatever the standards are for the general population, standards for healthcare professionals should be higher, but it's not. In this case, if a CBC employee comes back from a trip to Mexico, they're not coming back to work until they've isolated themselves for 14 days, but a healthcare worker is back on the job today. And, we're talking about caution. The only thing I can think in terms of a rationale for that is that, we're so desperate for healthcare workers that we can't afford to have anybody stay home. Otherwise, I don't understand why the same conditions that apply to everybody else that aren't dealing with sensitive people doesn't apply to health.
So I'll give you a few examples. Through case content investigation, there are several family physicians and several other people who work in the healthcare industry and dentistry who are close contacts of a known case. They are self-isolated for 2 weeks because they weren't using any appropriate PPE. But if you have traveled, you have no symptoms, you should self-isolate, but only specific, there may be specific situations where to maintain clinical continuity, you may be allowed to work with careful self-monitoring, with monitoring by your employer, and by wearing a mask, but that should be phased out very quickly. Ideally, all healthcare workers should follow the same direction. And I have to say there may be some other, exceptions like in other industries as well. But you're absolutely right. In healthcare workers, you have to have a high level of precaution. But the risk to them is also very different going forwards because right now we can assume that all healthcare workers know if someone has traveled that they can, use appropriate precautions. But there have been instances where, not so much in Saskatchewan, but other settings where people did not self-declare that they had traveled, they went to a waiting area. So I think all those considerations are also important, where you want to minimize healthcare workers who are on isolation, so they should be using appropriate precautions when they're looking after someone with a cough. But yes, absolutely. Ideally, healthcare workers should be isolated for 2 weeks, and they will be. But in specific circumstances where alternate arrangements cannot be found for a day or 2 or 3 days, that will be allowed with enhanced precautions in place.
So we got Karen the Den.
Yeah. Can we get some more details on the seventh case where this person is?
My understanding is it is from the U.S., from Arizona, but the investigation is progressing.
Is the person in Regina, Saskatchewan?
I don't have that information yet, but we'll provide that.
Okay. Sorry, I guess I'm... With regard to being low risk, I'm seeing on social media a lot of people on farms and in rural areas who aren't worried at all. And I guess I'm wondering if that's a misconception. How worried should they be?
So I think there's two ways of looking at it. One is that there is this sense that because we have a vast geography and dispersed populations, maybe our rate of transmission will be lower than large cities like Wuhan, China. But on the other hand, we have in rural areas a large elderly population, and hence, that was the issue in Italy that, so we have to be especially careful when visiting long-term care, personal care homes now at all times. and also be conscious of social distancing when visiting our friends and family who are elderly or have underlying risk factors, wherever they are in their homes. And then the other thing I just want to say is that in small communities, there's a lot of community activities that happen where there's a lot of crowding, and we really need to think about how those happen, should they happen, and how can you maintain a safe 2-meter separation, even if some of those may continue to happen. So I think all those considerations are really important. And not go to those community events if you have the slightest cough, sit those events out.
Got Dan and John.
Dr. Shahab, in one of your statements you used the word must self-isolate, and then in the same sentence use the word voluntarily isolate. So kind of mixed messaging there. A, are you tracking international travelers coming into Regina and Saskatoon? And why not mandatory self-isolate like cruise ships early on?
So the federal government was putting individuals who were repatriated from cruise ships and from 2 countries, China and cruise ships, into mandatory quarantine on their own facilities, like in Trenton. They were issuing quarantine orders for people who were coming back from Hubei, Iran, and Italy. They can no longer do that because the direction to self-isolate for 2 weeks applies now to everyone coming. So they can no longer do that for everyone coming. Having said that, very quickly the number of passengers is going to drop dramatically because the number of flights are going down. Canadians are urged to come back now. So we will see a spike in people returning over the next 2-3 weeks. We will see, because of that, a spike in cases that are travel-related in Canada and Saskatchewan, and that has to be managed. But after that, we should see, there's restrictions now on travelers who are not Canadian citizens coming to Canada. So after that, we will see a significant reduction in travelers in any case. So, as that happens, we'll have to adjust, our risk assessment. But overall, I think this will, in the short term, increase our risk because many people are coming back, over the next 2-3 weeks. But over the month or two, hopefully it will reduce our risk from travel-related transmission. But we have to recognize that even though we are very confident that we don't have any community transmission, we have to continue to watch for that through at least testing everyone who has a respiratory illness and no other cause in hospital, checking all long-term care outbreaks of COVID-19 if no other cause is found, and if someone has a respiratory illness, has not traveled, but needs care in a hospital, testing them for COVID-19 if another cause has not been found. All those things are being put in place to increase our vigilance to detect local transmission.
Premier, is there any plans to change the budget or suspend the legislature at this point?
Not at this point. We'll be moving forward with the budget for a number of reasons. The first of which is there are a number of initiatives in this budget that I think are very necessary for us to not only to discuss but to fund here in the province, and not the least among them is the resources that we are going to put into our public health care system here in the province, as well as resources in some of the periphery services that are provided in our communities. In saying that, this is a budget that is changing on the revenue side and quite potentially is changing on the expense side. And we will, at the first opportunity, either at the first quarter report or before, be very transparent and provide updates to the people of this province as to what those changes actually mean as we go through the next number of weeks and months. But know this, if there are resources that are required to deal with the COVID-19 pandemic in the province of Saskatchewan, those resources will be provided by this government.
We've got time for a couple more questions. I've got John that may.
Okay. Just of the cases in Saskatchewan, how many are confirmed and how many are presumptive?
So out of the 7, 2 are confirmed, 5 are presumptive, but we are very confident that once it's presumptive, it's a confirmed case.
Okay, and then just a follow-up. What is the capacity for testing, and are people being turned away and denied tests?
Yeah. So at the moment, the capacity is there, but we have to use testing judiciously. And right now, that means if you have traveled and have fever and cough, you are then assessed for testing, and if it's deemed you need testing, you are tested. If you are in Saskatchewan, have not traveled, have not been in contact with someone who has traveled or was seriously ill or diagnosed with COVID-19, and you have a fever or cough, your advice is stay home, rest till it's better. If it gets worse, you're assessed for influenza, other things that are transmitting. But if there's any concern, clinicians can and are testing for COVID-19. And that's how, tests were done for people who have attended large conferences, for example. So you have to mention that you went to a large gathering or a large conference. That can change the decision making, especially if symptoms are getting worse. And testing is happening now for people who are hospitalized with respiratory illness where another cause has not been found.
Got Wayne and Thomas.
Sure, the Premier touched on this a little bit already, but just wondering for employers and employees, if you're not certain, some are requiring you to take sick leave, others are saying you have to take vacation. Ontario's considering legislation to protect workers who are self-isolated. Are you planning any guidelines or any regulations as to what happens to people's jobs and their paychecks?
So we are having discussions with respect to ensuring that people do have the opportunity with the lowest impacts on their life and on their family household income to make that decision as simple and as easy as possible to self-isolate, because we most certainly do want people to self-isolate. So we haven't. This is one of the, maybe brings us back to the conversation around whether some of these decisions are ad hoc or whether some of these decisions should all be made up front or brought in over time, as we continue to have just these types of conversations with employees, with employers, with respect to how we can ensure that the process of and the decision of self-isolating is not one that's impacting families financially, and we would encourage all employers to take part in that conversation with their employees. And this gets into, first, we're looking at restrictions and bringing restrictions into place. Second, we are looking at what resources do we need to provide as we move through this pandemic affecting our communities. Some of those resources will be provincial. Some of those may be shared, provincial and federal. Some of those resources may be in the corporate world as well. We've seen the federal government come forward with some changes to EI already, and we applaud those changes. But this is a conversation that continues to occur. Do you have anything more on that, Jim? Or? Yeah.
Got time for one last question, Thomas.
Yes, like Dr. Shahab said, 24 hours is a lot. So how can a budget that was made weeks ago still be relevant?
The budget that we have is the budget that we would deliver if we were to look at it again today, and we continue to look at it. In saying that, there will be changes as we go through the first number of months with this budget. Likely changes on the short-term revenue side as we see what's happening due to global pandemic, to the stock markets and to commodity prices that impact our budget. I would also say that in many ways is piling on to some of the other challenges that we have experienced in this province over the course of the last number of months and years. There will be changes on the expense side as well, the investment side, most notably if there is a high degree of requirement for healthcare services, those resources are going to be made available. So the budget that we have has a number of initiatives in it that will help us address some of exactly what we're talking about, some of the recovery, if you will help us address some of the resources that will be required to be made available. And we're here to say today that we will be entirely transparent with the people of the province as this budget progresses through the next number of weeks or months. But I don't think anyone can predict exactly what that is. So we're going to move forward with the budget we have. We feel it's the budget that we want to present at this point in time. It will change. We know that. We'll be transparent with the people as to how that changes, and we'll also be transparent in ensuring they're fully aware that any resources that are required to navigate these waters, those are going to be provided.
Follow up? Thanks very much, everyone.